We see several people joining in on the webinar. Thank you so much. Glad you are here, and we will get started promptly at 11 a.m. Eastern Standard Time. Okay, again, we want to welcome you to today's webinar, Using CQ, Cultural Intelligence to Manage Bias. My name is Sandra Upton, and I am the Vice President of Global Diversity Practice with the Cultural Intelligence Center, a research, training, and consulting firm based in Michigan, but has a global footprint across the world. So glad that you have joined us for today's webinar. We are very excited about the conversation. Again, it's looking at using CQ to manage bias, the spectrum health model. We have participants joining us from all across the country, as well as other parts of the world, such as Canada and even the UK. And I believe that all of the content and conversation that you hear today will be relevant to you, regardless of where you are in the country and in the world. Just a couple of quick webinar notes. So all of you will be muted, and only myself and our guest presenter, Valissa, will be able to speak. If for some reason you get cut off, just call back using the Zoom link that you used initially to join our call. We will have a Q&A, so we are excited about and invite you to ask questions. And you can be thinking about those questions throughout the time. And then you want to just type those in the Q&A box, and we'll be monitoring that. And again, give some space on the back end to try and answer as many of those as we possibly can. Today's webinar will be recorded and available for access within 24 hours on our website. So if for some reason you've got peers and colleagues who were hoping to join us but could not, by all means, encourage them to go to the website and share the link with them. I think, again, they'll find the information to be incredibly valuable. And for those of you that don't know, we have a YouTube channel. This is actually airing live on YouTube along with our conversation here in Zoom. So if you have not subscribed to our YouTube channel, I encourage you to do that now so that you can stay up to date on things that are happening with us through that resource. So as we think about the conversation today, managing bias with cultural intelligence, I will tell you that part of the motivation to host this webinar and to have this conversation comes from the big announcement that we all saw earlier this summer when the governor, as well as the Department of Licensing and Regulatory Affairs here in Michigan, took a huge step to think through more deeply the healthcare disparities and equity issues that are seen in the healthcare industry here in the state. And as a consequence of that review, they have now imposed a requirement that every healthcare practitioner or every licensed healthcare practitioner go through some form of unconscious bias training. We think that that's a really good thing. It's an exciting thing, but it has also created a lot of trepidation by a lot of people. And we want to talk through that today. And in part, why we want to talk about that is because even when you think about the mandate, requiring unconscious bias training for healthcare providers, again, it's a good thing. It's a great step in the right direction. And we know that it's causing, again, many healthcare organizations and practitioners to be a bit anxious about how are we going to respond to this. And we think we've got some solutions that we can talk about today. But what we really want to emphasize as part of the conversation today is that even though this is a good step in the right direction, we also know that the research demonstrates consistently that unconscious bias training alone has very little, if any, impact on behavior change. And so what we don't want to do as we move forward to try and respond to these new regulations is to put ourselves in positions where we are going through the motion or going through trainings that at the end of the day will still leave us limited in our ability to change behavior that will ultimately close the gap in terms of a number of the disparities that we are consistently seeing in healthcare. And so we want to talk about how do we think about unconscious bias in a way and facilitate training and learning in a way that really does move us towards behavior change. So just to level set here, I want to highlight the way we define unconscious bias, and also for those of you listening in that may not be familiar with cultural intelligence, I want to make sure you understand what we mean by cultural intelligence, or CQ, as well. So unconscious bias is unintended, subtle, and subconscious thoughts that happen to all of us all the time. We all have biases. You've heard probably the term, you've heard people say, if you have a brain, you have bias. So we all have bias. Sometimes you might hear the term unconscious bias. You also might hear implicit bias, and we use those terms or see those terms as meaning the same thing. So we use them interchangeably. We don't see a huge difference in terms of the definition there, but all of us have biases, particularly those unconscious biases, and they're thoughts that happen to all of us all the time. Cultural intelligence, or CQ for short, is the capability to function and relate effectively in any multicultural context. So when we think about CQ in this definition, one really key word here is capability. It is a skill. So it goes beyond developing our sensitivities and helping us become more aware of cultural differences, or helping us become more aware of the biases that we have. Because just because we become aware of them, it does not guarantee that we're going to be effective or that we're going to change our behavior. So it's a skill that we need to build. And once we build that skill, that capability, it allows us to function and relate effectively in any multicultural context. And part of that functioning and relating is our ability then to be able to manage biases that we may have or impose on patients and others. So one of the most effective ways to manage bias is through cultural intelligence. So with that said, again, I just wanted to lay the foundation for our conversation today. I am so excited today to introduce my friend, my partner, the work that we do together, our strategic partner with Spectrum Health. The work that we do together in the diversity and equity and inclusion space is really exciting. And Valissa Armstead is here with us. She is the Director of Diversity, Equity, and Inclusion, system-wide for Spectrum Health, which is the largest employer here in West Michigan, and maybe one of the largest ones in the state as we think about some of the upcoming changes that are happening with them and another hospital system. And she may talk about that a little bit, but again, we're very thrilled. We've been partnering with Spectrum for many years now, and they have been on this journey for a while and have made, from our perspective, just some wonderful strides in the work that they're doing around unconscious bias and cultural intelligence. And so we thought it would be perfect timing, given these new regulations that have now come into play, to talk about what that means, what that looks like, and to give you an opportunity to learn from a system that's been at this work for a while. And so I was telling Valissa what's so exciting about what they are doing. When you look at these new regulations that have come in, they don't have to react to it like some do. But because they have been proactive and diligent in this work for years now, this is just something that is, confirmation for them that the work needs to be done, but they've already been doing it. So with that said, I am going to welcome Valissa and give her an opportunity to just give us a basic introduction of herself. And then I've got several questions that I'm going to ask her that I know you want to know about the work that Spectrum is doing in this space.
So thank you, Dr. Upton. I know you like to go by Sandra, so we can be a little formal. So thank you for the introduction. Yes, my name's Valissa Armstead, Director of Diversity, Equity, and Inclusion for Spectrum Health. So I've been at Spectrum Health for about 6 years now. And just to give a little background about Spectrum, it is a nonprofit health system. We are locally governed, and we have about 31,000 team members. Including our team members, we have about 14 hospitals. And when we think about our hospitals, we think about our ambulatory sites, which is about 150. We have physicians and advanced practice providers, which is close to 5,000. We have volunteers, and our volunteers go close up to 2,500. And so just in addition to a health system, we also have a health plan, which is through Priority Health. And with our Priority Health Plan membership, we have about 1 million plan members. So I share just a little bit of background. As we talk about culture, we have a number of different ways that we interact with various different individuals across the system, but not just across the system, across Michigan. So as you mentioned, us being the largest employer in West Michigan, that gives you some dynamics of our organization. My background, the reason why I got interested in working in the DEI space, I am an engineer by trade. And a lot of people say, how did you get into engineering and then move into the healthcare space or even get into DEI? Well, most of the time being the only African-American or the only female, myself, I ran into a number of barriers that prevented me from being able to progress within the workforce. So when you talk about being a woman of color, born and raised in an inner city, going to public schools, just the multiple intersectionalities sometimes can bring about some biases that can be put on me and prevent me from being able to move forward. And so as a female of color, I wanted to ensure that other people didn't run into the same issues that I did. So I got involved in a lot of social justice advocacy work and been at Spectrum Health for about 6 years. But prior to even being at Spectrum Health and being in engineering, I'm a part of a sorority that focuses on addressing social justice issues. And I've been a part of that sorority for 30 years. And so my time in a sorority addressing those issues, Delta Sigma Theta, shout out, sorry, had to do that. But being a part of the sorority had allowed me to be a volunteer in this space for now 30 years. So it is truly a passion of mine. And so I came across Coach Intelligence, and I'm probably jumping ahead, but I came across Culture Intelligence Center before I started at Spectrum Health. I was with another large organization, a large global organization that was in education, and we adopted a cultural intelligence model and the framework, and I saw how it really benefited education. And so when I ended up employed with Spectrum Health, taking the same approach with DEI, wanting to understand what is our bottom line, and our bottom line being able to really improve patient care and patient outcomes, then my focus became, how do I help our leader at that time, Jennifer Jackson, was leading DEI, and Kristen Ekins, who was actually also a manager at the time. How do I partner with them to bring cultural intelligence to Spectrum, tie it to our bottom line, and see how we can help improve team member interactions, as well as improve patient care and any other populations that we come into contact with. So just a little bit about myself and how I got involved in cultural intelligence, and how did I help to bring it to Spectrum Health.
That's excellent, Valissa. And it's interesting because some of the work that I've done with Spectrum years ago, even before you and I had the opportunity to meet and begin to work together, even back then, you know, there was an interest in the work around cultural intelligence and unconscious bias. And then, of course, when you and Kristen and others came on the scene, you just took that work to a whole nother level. And so it'd be great if you could just take us through the journey around your work with this. You know, how did you take that to the next level, and what's been that journey and process since then?
Yeah, so the journey, again, starting 6 years ago, so we're not new to this space, right. But part of it was starting with sharing the business case, and the business case for bringing unconscious bias and cultural intelligence. So talking about unconscious bias was not a huge roadblock in order to talk about how understanding biases actually can impede patient care, but also how can, if you don't understand bias, how can it impede things like being able to better recruit and retain diverse talent, and also helping our ability to improve in spaces such as supplier diversity. And so when we brought cultural intelligence and we talked first about how can we adopt cultural intelligence, I can really remember leadership saying, we don't do training for training's sake here. So this is not going to be a check the box. And so we really wanted to ensure that they knew that adopting cultural intelligence was not a check the box, but this was a platform that provided a framework that had been proven and validated, even with the only academically validated assessment, to help focus specifically on skill building. So not just your typical DEI training, which we hear all the time. This is a DEI training. And we wanted to ensure that, no, this isn't a DEI training. We really want to get strategic with how we roll it out. And so once we received approval to be able to move forward, the first things we wanted to do was pilot the program. Even though, from an outside perspective, we saw the value in it, we needed to make sure that our leaders supported the work as well. So we piloted, and when I talked about being strategic, we wanted to pilot it on two different sides. So we piloted with our non-clinician group and a clinician group. So we have a separate group that focused specifically on improving health outcomes of our patient population, specifically within the community. And then from a non-clinical group, we wanted to start with talent acquisition, because that is our frontline gatekeeper, if you will. And so we piloted, we reached out to both the leaders in the department and shared, this is what we would like to do. They were both very willing for us to be able to roll it out to their entire team. So both teams was about close to 200 individuals. And so we broke them up in subgroups, and we wanted to see how we could best roll it out. So part of that included, do we roll it out to all of the team members and include all leaders? Or do we roll it out starting with leaders first, and then later bring it to team members? What would be the best model? And we found that it depends. So we want to make sure that we took a consultative approach and be able to really hear from the leaders, understand what dynamics might be taking place within their department. And that gave us insight on how best to roll it out. Because when you're talking about things like unconscious bias and its impact around the 4 capabilities such as CQ, you get into some very sensitive conversations. And we wanted to make sure that we created a safe space to have those conversations. Because again, we wanted to be able to move the needle on our improvements in retaining and attracting diverse talent, but also in our ability to be able to look at ways to find interventions to help improve patient care. Now, being in DEI, we are not the operations team, so we can't do a lot of the implementation, but we can influence the work and we can bring best practices. And so I also call ourselves, which is one of my mentors share with us in the DEI space, you become chief collaborative officers. You learn how to pull people together and get a lot of work done. Well, part of that, bringing in the right individuals to the table to talk about how we can roll out the training was to make sure that we built those relationships, took that consultative approach to see what would be the best way to roll out the training. So we did get a chance to roll it out, and we did find that there was opportunities to both delivering the training when leaders are in the room, delivering the training when leaders are not in the room, and then being able to share how we can go from there. What we also realized is that we always say in DEI, we're a small but mighty team. And if anybody who's on this webinar and from Spectrum Health know that the DEI team is not very large, but we have a very large group of ambassadors who really help us move forward this work. So we decided to create a community of practice utilizing the CQ Center's partnership, and created what we call now our CQ Facilitators Network. And that was a number of individuals who our leaders agreed to be able to help us invest in. They became certified in unconscious bias and cultural intelligence. And through becoming certified in both of those areas, that allowed us now to be able to take the training, unconscious bias and cultural intelligence to scale in a face-to-face environment. Now we're virtual because of COVID, but we took it first in a face-to-face environment. And again, that was still part of that pilot program. So we received some learnings from the pilot. We received some learnings from how to best support our CQ Facilitators Network. We started off with 12. We now have just about over 30, and we're getting ready to take another group through the training, since we have things like Laura that has allowed us to change our training now from being open enrollment to required for everybody in our system. And so it's just been a great journey. So far.
Yeah, that's fantastic, Valissa. And I'm hoping those of you that are listening in are getting some of the tips already. I mean, she's highlighted the fact that, you can't check the box, or you shouldn't want to just check the box, the importance of creating a safe space and collaborating, and then this community of practice. So already some really good nuggets that I hope you are grabbing hold of. But as you're listening, please type in any questions that you might have in the Q&A box, because we will come back around to that and do our best to answer as many of those as possible. So Valissa, since you mentioned Laura, and since I mentioned it at the beginning of our conversation, everybody's talking about it. And again, for those of you that are listening in that are not here in Michigan, this still applies to you, because if you don't have any new requirements in your state or in your part of the world, my suspicion is that at some point that is going to come. And so the more proactive you can be, the better. And most importantly, we should want to do this work because we need to do the work, not because it's being imposed by any government or any regulatory body. But given that it is here in Michigan right now, and you said that's a good thing, and it allowed you to shift from the mandatory to the required, how do you feel about that? And how do you feel about how prepared Spectrum is to make that switch? And do you think it was a good decision by the government and by the department?
Yeah, and I probably need to clarify too, because we was on a journey to making the training mandatory before Laura. So while I'm excited that they have made that a requirement, is in my opinion, it's about time. We have, I think, part of this highlight of making it mandatory, having a requirement for licensing had a lot to do from a healthcare perspective of seeing a number of disparities within individuals who are Black, Brown, individuals with disabilities, LGBT community, just a lot of disparities that we have still yet to close the gap on some of the disproportionate rates on health outcomes. And so to be able to have the backing of the government seeing the significance of really understanding how bias plays a part in the disparities that we see has been fantastic. And so in my own personal opinion, I think it's a good thing that we are having this requirement. I also feel excited to know that we had already started this journey. And so in terms of our preparation, we're not working behind the ball. We try to get things set up, but we are continuing the momentum to ensure that not only we meet the requirements of our compliance regulations, if you will, but that we also get an opportunity to see the end result, which the end result is, how do we ensure that we are improving patient experience? How do we ensure that we are being proactive in our opportunities to try to avoid discrimination, because discrimination still exists. And we see that whether it is unconscious or consciously. So how do we in a DEI space leverage tools like unconscious bias and cultural intelligence to be able to mitigate some of those risks before it impacts our ability to improve patient care or support our team members or do right by our health plan members as it relates to Spectrum Health. As it relates to, just statewide, we have a lot of work to do, especially when you think about COVID and how COVID highlighted a lot of the disparities that has been in place. So just banding together and knowing that we have the support from the state with implementing interventions such as this, I think is great.
Yeah, and I think it goes back to some of the comments you made earlier, Valissa, in terms of some of the strategies, because I think a tendency could be for those who are not required, they know it's not an option. It's really easy to look for ways to check the box, to say, I did it. And that's what we don't want to do. And so I think, again, the work that you've been doing, and everybody obviously are not where you are and how far along you are on the journey, but recognizing that it is a journey, but that it is important to get on that journey and do things the right way so that the work really does become sustainable and meaningful. And we really do move towards behavior change, ultimately closing some of those gaps and disparities. Why do you think CQ is important and the necessary strategy for addressing unconscious bias? You know, we always qualify, we're very proud of the work that we've done. We're very proud of the research behind the work that we've done. We know that is what makes us different in many ways, but we recognize that there are other models and tools out there. So we don't suggest that we're the only ones out here. We need all of us who are doing real good quality work to be doing this stuff. But why did you continue to choose CQ and UB as you stepped into your role and work to move this stuff forward? Because again, there are many other models out there. Can you talk a little bit about why you made that choice?
I can. You're exactly right. There are a lot of models out there, and we still use some of the models within Spectrum. Part of the reason being, we also have Spectrum Health University. So the university also helps to partner up with us to deliver different type of models out there as it relates to addressing, or as it relates to better understanding our team members. So when you think about things such as personality assessments, cultural competency assessments, a lot of those look at both your personality, your preferred preferences, in addition to skills. But what I found about the CQ Center is they have been the only ones that really focus on skill. And it doesn't just come out of the diversity space, but it comes out of the intelligence space. And so we have an opportunity to really help move the needle and move towards behavior change and not just awareness. So we do my CQ Your Bias, and that is the first foundation to really becoming aware of yourself, as well as aware of those around us. And we use that strategically when we're doing the sessions and aggregating information to get a sense of, if we're doing intact team trainings, what does the team look like? What is the makeup? Because that helps with the first step. But then there needs to be the continuation, which is, now that we've come into awareness and we really understand things like the culture values profile, which helps us better understand from both a domestic and an international perspective, what do we do after we have that information? And that's where the culture intelligence piece comes in. Now that we know where we are in understanding ourselves, how can we better understand where biases takes place along the 4 capabilities? And then how do we create now actions to, move the needle on improving ourselves or improving the way we interact with others? So I think for us particularly, and I can speak for why I pushed to adopt this model, was really because of that skill component, and that it provided us a way that also validating information that shows towards decision-making improvement, towards collaboration, improvement towards negotiation. It has that validation there that we can tie it back to specific job categories as well.
Yeah, that's great, Valissa. And that's the perfect lead into the next question that I want to ask you. People listening in could say, yeah, that's great that you've been at this for 6 years, but what results? Bottom line, what have been the results of the work? So a 2-part question, how have you attempted to measure your work in this space? And then what results have you seen? Have you seen those disparities? Have you seen those gaps close? Have you seen people change behavior? Have you seen performance improve? So talk to us about measurement and impact.
Yeah, so and let me say too, that we have not yet arrived. So I don't want people to think just because we've implemented CQ that we are where we want to be, because it is a journey, and that's why we adopted a movement and not a moment. But we've seen a lot of ways that we've measured success. For one, just the conversation. We've never been in a place where we've had CQ or unconscious bias as a mandatory requirement being led by our CEO and now spread across the entire system. unconscious bias now being mandatory is a part of our strategic initiative. So it is measured by the number of individuals who go through the training, and it is tracked on our systems dashboard. We also measured, because we used it very strategically, we identified areas maybe about 3 years back that where we had shortage of diverse representation across 3 specific job groups. And we created a focus group, but before creating a focus group to identify where the gaps are, we wanted to make sure that we had a common language and common framework to work from. So we created a workforce diversity team, workforce diversity task force, to be able to bring them together, take them through the training, and then see, based on them going through training, that included hiring leaders, talent acquisition, operational leaders, and DEI at the table, to identify where the gaps were in our representation. And then how do we make some correlation based on that work with identifying the gaps, finding out what the challenges were, and then utilizing that framework to create interventions. And so we have some measurements there that shows progress amongst how we were able to increase representation where representation was low. Where we're really trying to get at now is, how do we really tie it to patient care? Patient satisfaction scores have, patient satisfaction or HCAP scores have questions in there that's related to culture that can give us some insight into how well we're doing when it comes to patient experience. So we partnered up with several different departments, such as our environmental services team, such as our patient access team, to be able to see how can we look at our processes and procedures from a DEI lens, leveraging cultural incompetency and unconscious bias training to be able to be the foundational elements to look at how we can make progress with improving our patient experience. And most recently, we're looking at, could we be able to make some correlations with health outcomes if we are rolling out training to our clinicians, and we look in at rolling out training based on specialty. And if we do this trainings based on specialty and just follow that process, the training as well as the assessments to see, did we move the needle on the assessment and did we move the needle on health outcomes? Could we make some correlations with it lining up to when we actually did the training? So we're trying to get a little bit more strategic with how we leverage the training to see, are we moving the needle with the training? Again, so that we are not doing training just for training's sake.
Yeah, that's great, Valissa. And I'm imagining people listening and some thinking, wow, that's quite impressive to see. Like you said, it's a journey, it's a movement, you've not arrived, but you certainly made progress. And when you can get to that place where you can actually measure outcomes, that is sort of the golden spot that all of us want to get to. But then you also might have some folks listening in who may say, that all sounds great, and I'm in an organization, a healthcare organization, or I may be a dentist, or and have my own practice, or whatever space they may be in, and they feel like, boy, we're just trying to get our arms around how to start this work. And it'll be a while before we come anywhere close to where Spectrum is on this journey. What would you say are some of those sort of the non-negotiable building blocks that, even as they are getting started, that you cannot not do, right? And maybe they can't even do it at the scale that Spectrum is. Maybe the budget's not there. Maybe they don't have full leadership commitment right now. But what are some of those basic things that really have to be a part of that journey and movement to truly move the needle in the right direction?
Yeah, I would, definitely recommend starting small. If you have an opportunity to run a pilot, the unconscious bias is it's that foundation, that awareness. You talk about some of the challenges that many individuals face within the organization, things like microaggressions that can seem very subtle. Those are key things that you want to be able to, have conversations about and talk about them. But if you're going through the unconscious bias training, you get a little more insight about that. You also have areas where you can deepen the learning. So when we talk about awareness, we do have cultural intelligence, we do have unconscious bias, but there might be times where you need to bring in more target focused training, such as during our journey, we realized that we needed to create a course called People Beyond the Alphabet, LGBT 101. And so we were able to leverage our certified facilitators to help deliver that training, because again, we utilize unconscious bias and cultural intelligence as the foundation to build the rest of the training. So I would say for somebody starting off who may not have budget, find a way that you can also align it to smaller areas. Find if you have employee relations, see what type of employee relations challenges you have, and see if you can target departments that might be challenged in that space, and roll out things like unconscious bias, pilot it in that space first, and then show that you're moving the needle on the process. Low-hanging fruit, see if you can partner with talent acquisition, in your organization, and focus on increasing diversity in your workforce. Just start off small and build your bench. Non-negotiables to me, though, is for our organization, we needed to have in-house CQ facilitators, because we needed to be able to, again, create additional training, find ways to sustain the work, and then find ambassadors to help us do the work, because we're not a large team and we can't do this work on our own.
Yeah, that's great, Valissa. And the questions are coming in. And so I want to, in a moment, transition and start to address some of those. But before I do that, you used the word challenge at least 3 times in your last comment. And I was listening to that and thinking, I want to kind of flip that and highlight. We've done a phenomenal job of highlighting the progress and the success from the work, but we know that this kind of work is not without its challenges and setbacks. So maybe can you share a little bit about what have been some of the challenges with this work? Some of the, just be real with people, right? And what have been the setbacks? How have you responded and sort of got back up and kept things moving forward?
Yeah, so when it came to even looking at in-house facilitators, it's very important to really know and vet your facilitators. And not that the facilitators can't facilitate, but again, you have conversations, and some of the conversations that you have in that space that you've created a safe space can be very taxing. And you can actually get burnt out and come out with, have psychological, you want to create a space that provides psychological safety. And when you're in a DEI space and you have a passion for being in a DEI space, it's easy to do the work because you put that passion in the forefront. But in a space that we're in right now, looking at a lot of disparities, and if I can give an example, just last year when we ran into the George Floyd situation, and now you have a heightened challenges around addressing racism, that brings about another level of emotions when you are working in a space. So you really want to make sure that if you have certified facilitators, that they really are prepared to be able to lead this work, because it is not for everybody. And I think sometimes, when I'm talking to other people, I talk about why DEI space, and historically may have taken some time to, really get to this place where you have spaces that have chief diversity officers and people having this conversation. The conversation is not easy to have. It is tough when you run into certain issues. So that becomes a challenge. And for us, that caused us to take a step back and really look at a vetting process to make sure that we have facilitators that really understand what they're getting ready to, how they're getting ready to deliver the content and what kind of conversations can happen within that space. The CQ sessions cover a vast number of cultures, but it does not cover everything. Multicultural is so large. When we were, in our space and we were looking at just the number of languages spoken around our patient population, we have 150 languages spoken and signs. And that's just within our organization. When we look at the Office of Budget and Management, the government collects that information. they were collecting over 500 different languages spoken around the country. And so, and in terms of ethnicities, it was like over 600 collected. So there's a lot of different scenarios that can come into play that you may not be aware of. And so it's just important to really be able to understand that you may run into situations that you have not encountered before, and you want to be prepared for that. So lesson learned for us was definitely being able to apply a vetting process. Another process we learned was in some spaces we had to deliver our training to leaders first. And it was because we wanted to show the value of the training and that it is not just for training's sake. It's not always easy to roll it out when you're working in healthcare because you have competing priorities. And so when you do have those priorities, you have to be flexible to see how you can best work to assist the individuals who know that the training needs to be done, but how do we do it in a manner where it doesn't interrupt patient care or it doesn't interrupt productivity, whether it is on the clinician side or the non-clinician side. And then the biggest challenge or area of opportunity, maybe I should say that because it's brought a lot of opportunities, is being able to take the training to scale. And being able to do it in an online environment. It required a lot more resources, and we still learn a lot through this process, but it's allowed us to reach a greater audience across Michigan because, you know, our work expands not just in the West Michigan area where we're located, but on the east side of the state in Detroit area. So in Lakeland area. And so we want to make sure that we are being able to reach the masses. And so having a chance to learn more about how can we deliver in a virtual environment, but make sure it's effective in a virtual environment has been one of the areas of opportunities we've been working on, and we're still working through that today.
Yeah, that's great, Valissa. And, you know, when you talk about all of the different forms of diversity, you know, you highlighted language and ethnicities, but we know it, like you said, it is so vast. And I think that's one of the significant benefits of CQ is that you are able to contextualize and dig in more deeply on topics that are very unique and pain points that only your organization is facing or are facing at a certain period of time. And CQ still allows you to navigate regardless of the form of diversity or diversities that you are needing to make sure you address in the DEI space. You know, another thing that you said that I thought was interesting, you know, Spectrum, like many other organizations, you know, there was a wake-up call with the whole George Floyd incident and the many others that we could spend all day talking about. But it reminded me of the importance of needing to pivot. You know, we use that word a lot with COVID, you know, everybody had to pivot and do online training and all of that. We were very much a part of that movement too. But these issues that happen and these big events, sad events that happen that require us to pause and adjust. And I know Spectrum did, you know, you had a day of understanding. I believe that's what you called it. And I think you've done another one since then, correct me if I'm wrong, but you adjusted to really hone in on that issue. And again, it's a reminder of the importance of being agile in this work and staying focused and strategic, but also paying attention to what's happening in the broader society and how that has a direct impact on the organization and on the work that you're trying to do in the DEI space. Anything you'd want to add to that?
Yeah, you know, when you start getting into having to pivot, it's important really to know your organization and where you need to pivot. So I'm grateful that we've been able to continue to utilize CQ bias, unconscious bias, and utilize that as a foundation to start the conversation. And bring about that awareness. And from a day of understanding perspective, we've also provided tools to continue the conversation and start having even more daring conversations. And then to continue to build off of that, leveraging our talent within DEI, we're also creating an anti-racism learning plan, and that will be able to continue to go deeper in that space. But again, everything starts with that foundation. If you don't have that awareness, it becomes tough to have that conversation. And so that's the framework that helps us set up to be able to go deeper in the learning and the
Yeah.
education.
Absolutely. That's exactly what I was thinking. You got to have the foundation. The conversations are never going to be super easy, but it definitely gets better and it feels safer, right, to have the tough conversation because you have built that foundation. You've got that common language that you talked about earlier. You've developed that psychological safety, and that makes a huge difference in the work. All right, so fantastic comments so far, and I'm guessing that people have been taking copious notes, but now we're going to dig into some of your specific questions. So we welcome the wonderful Shayna back to the screen, and she's going to share some of the questions, and then we'll determine who would be the best to answer them. So Shayna, what's question number one?
Sure, we've got a lot of really good questions coming in. I'm going to combine a couple questions for this first one. So were your leaders aware enough to know what was really going on with their team members on the front line, and how did you get buy-in?
Okay, that's a Valissa question for sure.
Yes, so we did. So some of the leaders were aware of some of the challenges that was happening on the front lines. As a matter of fact, some of our leaders were the ones who actually raised their hand to have their intact teams go through the training. And in some cases, the leaders would, if they knew that there was some different dynamics and they wanted to create a safe space, then what they would do is they would come in and introduce themselves and share the importance of the reason why we're having the meeting, and then they would leave out the room. And then that would give the team members an opportunity to share. Some leaders, there was not anything going on, but they just wanted to provide a safe space, because even if there's not anything going on, some people still won't feel comfortable sharing when there's leaders in the room, when you're talking about biases and some of the challenges that they may face when you, especially when you start getting into microaggressions and examples of microaggressions that might be used.
That's great.
All right, thank you for that. Another one, how does one implement a CQ culture? What are the key milestones?
That's a good question, because we're still on the journey. And I would say that, you know, some of the milestones I would share is buy-in from leadership. We've been very fortunate. Tina Fries-Decker is our CEO. She started off as our executive VP, and she was also one of our, she didn't start off as executive VP, but she was an executive VP, and she was also one of our leaders of our inclusion resource group. So she was very engaged in DEI work. And when she moved into the CEO position, she still continues to maintain a focus of ensuring that we have a culture that is respectful and embraces diversity and ensures that people have a sense of belonging. So it helps when you have leader at the very top that is supporting DEI work. And then from there, we have a Chief Diversity Officer, Oville Barbie, who's also been instrumental in helping to lay the foundation for the work. So I think if you have the leadership buy-in first, and you take your strategy and integrate CQ into your strategy, then you'll build your milestones around there, because CQ is actually integrated into our DEI strategy. It's not a standalone. And I don't recommend that it be a standalone. I think it should be used strategically.
Yeah, that's great, Valissa. And I would just add to that, you know, sometimes you also need to take a pause and reflect on where you are on the journey, because every organization, healthcare and otherwise, is at a different point in that process. And I can't tell you how many times I've seen organizations, as they're doing this work, take what I call more of an activity approach versus a results approach. And they oftentimes are doing things or activities around the work, checking the box, and they have really, no idea if what they're doing is even the right things, right? Are they the right strategic things to be able to know what the milestones might be? Or even if they are doing the right things, which in some instances they are, they're not measuring the impact of those efforts. And so sometimes, you know, when we talk about determining milestones, a first step might be to just really step back and do a formal assessment of where you really are on the journey. And then once you determine that, then you can begin to identify what key steps and strategies are necessary. And then from there, build those milestones and KPIs and those sorts of things to attach to that. So that's always an important thing to consider. Another question, Shayna.
Yeah, this one kind of leads into the next one. So somebody from our YouTube live stream was wondering, how do you suggest going about collecting so like your internal demographic data ethically to foster diversity and representation? And what are some of the possible unintended consequences or harms from collecting that data?
So for us in DI space, our compliance requirements for federal government requires us to collect the data, and we collect it, but we also make sure that we are adhere to the requirements of Title VII under the Civil Rights Act, so that we are not discriminating against anyone. But the purpose of collecting the data is to ensure that you can identify the gaps so that nobody is being missed out on opportunities because of the demographic background that they bring. So from a compliance perspective, we are required to collect data.
And that's a really good question, because that is becoming just a hot topic, data, right? How are we collecting that data? And then how are we using that data to inform decisions around diversity, equity, and inclusion, and closing those gaps? So we want to know the experience of African-American patients compared to white patients, or we want to know the experience of elderly patients compared to, younger patients. And so that data does and is becoming more and more important to use to inform. Have you been doing a lot of work in that regard, Valissa, using that data to inform and slice and dice how you respond?
Yes, so we signed what is called the 123 Equity Pledge back in 2017, and it's a national call to action to eliminate health disparities, but to do it at a local level. It's based on a lot of research. You can look up Dr. David Williams, a book called Unequal Treatment, but it talks about a lot of the disparities that exist across the system and how you can utilize a term called targeted universalism to identify gaps, close those gaps, and then the intervention that you come up with that closes that gap actually helps to support all patients. So it's not isolated just to supporting one particular population. So with that being said, one of the ways to be able to measure success of hospitals is based on patient outcomes. And we want to make sure that we are collecting data so that we can better understand the population that we serve in order to create more personalized care, because not all individuals are the same. So as I mentioned, having over 150 languages spoken amongst our patient population, we need to know that information so we can better understand the cultural dynamics, what might be going on, where we might need to pivot. If I was to use the CQ model, how we might need to strategize in order to best support a population of patients. And then, but the information they provide is voluntary. So it's very important for us up front to share why we're collecting the data, why we're asking for it, how it will be used, so that patients can feel comfortable enough to provide that type of information.
Great. Other questions?
Yes, I have just a couple more questions. So the next question, how can this model be crafted to accommodate the needs of a much smaller workforce? And then another person was asking how they can actually get trained and certified. So if you could speak to that, Dr. Upton, be great.
Sure. So I'll let Valissa take part one and I'll take part two.
You want me to take the one about how do we apply it to a smaller organization?
Yes.
Okay.
What are your thoughts about that? And I can add to it, but I'm curious to know your thoughts.
So I've been fortunate. One of the things I didn't share that I have been fortunate enough to have my own practice in implementing unconscious bias and cultural intelligence. So I've had a chance to work with smaller organizations in order to implement CQ training. And so it's the same. It is understanding the bottom line. What is the mission of the organization and how do you tie it and integrate it within that organization? So I was fortunate enough to work for an educational organization, and we took CQ and integrated it and created a new mission statement, and then all of the work around that tied to the mission statement. So how do we ensure that we are graduating individuals who are culturally relevant, culturally intelligent and ready to go into a workforce that was diversity? And we started with the small faculty first and then moved into administration and then also delivered the training to students. But the administration and faculty itself was a smaller group compared to Spectrum, but it's still the same model. Get the leadership buy-in first, understand how it ties into the bottom line and the mission, and integrate it into your system.
Yep, absolutely. I would agree with that 100%. And don't look at it as a one-off. So it's a lot of the same principles that Valissa talked about at the beginning. Don't see it as this separate training that's on the periphery, but it's a core part of who you are. And even and I know some of you that are listening in may feel like, well, I'm not able to get buy-in from leadership. So should we just sort of throw in the towel and not try and do anything? The answer is no. You start where you can. You find out where your sphere of influence is. I've had, thinking about the university setting, the example that Valissa gave, we've worked with numerous universities where, faculty on campuses oftentimes have lots of influence, but sometimes that's not where a person is able to start. And it starts with staff, and it may just be in residence life, or it may be in the admissions office. So think about where your sphere of influence is and get in there and get people engaged, get the language in there, build it into the DNA, and then begin to demonstrate some success. And then oftentimes others are paying attention because they want to be successful as well. And then it catches fire, and then other departments begin to implement it, and it eventually will make its way up to top leadership. So the exact same principles apply. You may not be able to go as fast, you may not have as big of a budget, but you can start, and you find out where you can start, and then you move things forward from there. We've got 5 minutes left, and I just want to I want to thank you, Valissa, so much for all of your phenomenal insights. I've learned some new things, even though I work very closely with you and others at Spectrum. Just some fantastic insights. One other question, and before I transition and pull my slide deck back up, one person asked about the vetting process and how you go about that. And I'm going to just jump in and very quickly say two things. When you talk about vetting folks to facilitate, they need to have two sets of skills, or two things. One, they obviously need to have a passion for the work. That's critical. But then they also need to have good facilitation skills. And that's not always as easy. Because sometimes people have one or the other. They're very passionate about the work, but they may not be the best person to put in front of a group. Other people may be incredibly good at facilitating, but they can't handle the content well. And so you need both of those as you are identifying people. And then the process, I know Valissa can speak to this, but the process is, there are lots of ways to do it. But one of the ways that you can do it is to invite people to apply, to let them see how important and serious it is, and that them being selected is really a privilege to be a part of the community of ambassadors and facilitators, and then take them through that process of making sure that they have those two key pieces and they are ready for the work. So Valissa, I don't know if you have another quick comment to add to that before I kind of wrap things up with the group here.
No, I think you said it, exactly the way we do it. We took during our day of understanding on the last one, we put out a call to action. Anyone who is passionate and interested in becoming CQ facilitators. And that's how who, they raised their hand and said, I would like to do this. And then we took it from there, which is, seeing who's good at facilitation. From a Spectrum perspective, wanted to make sure that they leaders support it, because that is time commitment in the process. So yeah, everything that you said.
That's great, Valissa. And I just want to wrap up by, again, thanking everybody for joining us for today's webinar. I also have an exciting announcement, and that is we will be offering our very first public CQ Your Bias in Healthcare workshop coming in October. The date is Thursday, October the 28th. It's a 4-hour public workshop, Eastern Standard Time. It is open to any and everyone, not just in Michigan, not just in the US, but across the globe. We will be covering topics and issues that we think are relevant to most healthcare organizations and practitioners. Here on the screen here, you just see a few things highlighted. I won't go through all of these, but we're going to be getting into why bias matters in healthcare and how do we identify our biases, and most importantly, what are the strategies we need to put in place to manage our biases. For those that live in Michigan and that are practitioners and healthcare providers, the training will allow you to meet those requirements by Lara. So that is a good thing, but again, it is not in any way limited to just people who are in Michigan. So if you're interested in learning more about this, you can feel free to reach out to Jennifer Benbow, who is our Director of Public Programs and Partners, and you can see her email address here on the screen. Shana maybe will type that also in the chat box or the Q&A box, but you can follow up with Jennifer and she can let you know if you're interested, let you know a few more details and when registration will officially open for this upcoming training. So again, I want to thank everybody for joining us today. We've got 60 seconds left. Valissa, any parting words on your end? You've shared a lot.
Just thank you for everybody for joining, and hopefully those who are involved in this work, I wish you much success.
Fantastic. Thanks again. Again, this is recorded, so if you want to come back and listen, there were so many cool nuggets here. You might need to come back and listen again. You can do that, but you can also share this with your peers and colleagues. So enjoy the rest of your day, afternoon, evening, and we will see you at the next webinar. Thank you.
All right.